People with disabilities, representing 15% of the world's total population, are among the hardest hit in this crisis in terms of fatalities. It's not that COVID-19 attacks disability per se, but the fact is that we have a greater likelihood of experiencing comorbidities. Comorbidities such as heart disease, lung disease, obesity, and diabetes, among other conditions and diseases. Comorbidities that make us less resilient to fight against the infection once contracted. That makes negative outcomes more likely. People with disabilities are more likely to live in poverty, and that's true here in the United States, where nearly 26% of people with disabilities are living in poverty as compared to just over 11% of those without disabilities. And according to the World Bank estimation, 20% of the world's poorest people have some kind of disability. Living in poverty means that you lack access to good nutrition, sanitation, healthcare, as well as safe living and working conditions. People with disabilities are also more likely to live in congregate settings without any ability to safely social distance. And in those congregate settings, we are reliant upon personal care attendants, creating a greater propensity for contracting the disease. The pandemic has unmasked significant disability bias, particularly in healthcare settings where healthcare providers outright refused to provide care and treatment for those of us infected with the COVID-19 virus.